the innate immune system is active in MDS. And we think that the innate immune system may contribute to some of the cytopenias that we observe. And chronic inflammation, high levels of hepcidin are long known to have decreases in erythroid function and erythroid generation. So if these disorders, the clonal changes that give rise to MDS, are actually responsible for some of this inflammatory background, being able to shut that inflammatory background might blunt some of the consequences of having MDS. And it may not be true in every patient, and it may not be true necessarily in patients with higher risk MDS that may have more cell autonomous effects driving their disease, but in some lower risk patients that may be a good way to address it. We've recently learned about another diagnosis, a syndrome called VEXAS, V-E-X-A-S, that is an autoinflammatory syndrome that's associated with a somatic mutation in an X-linked gene called UBA1. And the reason that this is really interesting is because these patients have a high propensity of getting MDS, and in fact some patients are diagnosed with MDS before they're diagnosed with this autoinflammatory disorder. So clearly there's a connection between this inflammatory signaling and this clonal expansion of these cells that go on to become myeloid malignancies. That's giving us some insight in some extreme cases about what may be going on more commonly in other cases as well.